Hello students, how are you? Welcome to PG Department of Social BM Body Cross College. Today we are going to discuss module 4 of Health Planning and Management in the subject Community Health for Development Practice and Healthcare Administration and Community Health. ഈ രണ്ട് സബ്ജക്റ്റുകാർക്കും കോമൺ സിലബസ് ആണ് കവർ ചെയ്യുന്നത്. കോമൺ ടോപ്പിക്കുകളാണ് കവർ ചെയ്യുന്നത്. എല്ലാവരും മൊഡ്യൂൾ 4 കമ്മ്യൂണിറ്റി ഹെൽത്ത് ഫോർ ഡെവലപ്മെന്റ് പ്രാക്ടീസ് ഹെൽത്ത് കെയർ അഡ്മിനിസ്ട്രേഷൻ ആൻഡ് കമ്മ്യൂണിറ്റി ഹെൽത്ത് മൊഡ്യൂൾ 4 MG യൂണിവേഴ്സിറ്റി സിലബസ് അനുസരിച്ചുള്ള മൊഡ്യൂൾ 4ന്റെ കാര്യങ്ങളാണ് ഇന്ന് ഡിസ്കസ് ചെയ്യുന്നത്. യെസ്, we come to the point. Okay, module 4, it is described about health planning and management. What do you mean by planning? In every action we should have some proper planning. When we construct a building or any house, then we should have some proper planning to construct that house in proper way. So we need to discuss what is planning. Planning is for the future purpose. We need to plan for our future action. Yes, we come to the concept of health planning. It is the part of national development planning. Health planning is necessary for the economic utilization of material, manpower and financial resources. The purpose of health planning is to improve the health service. The planning where come to the health area, then we need to proper planning for the financial resource and purpose of health planning to improve our health service. Now we shall discuss another definition for the planning. Planning is a process of determining the objective of administrative effort and devising the means calculated to achieve them. If we have any plan, then we need to achieve that in proper time. Next, we shall discuss another definition for planning. Planning is a process of setting formal guidelines and constraints for the behavior of the firm. Yes, planning is the process of setting formal guidelines. We should have some guidelines to do something in proper way. If we need to, if we have a proper plan to do something, then we will achieve the success of that action. Okay. Now we come to the National Health Plan. We are going to discuss National Health Plan. Now I am discussing National Health Planning on the basis of our country, India. If you study in abroad, then you need to study the national health planning of that country. If you study in Canada, then you need to study about that country's national health planning. Now we are going to discuss the Indian perspective of national health planning. National health planning has been defined as the orderly process of defining national health problems, identifying unmet needs and surveying the resources to meet them, establishing priority goals that are realistic and feasible, and projecting administrative action to accomplish the purpose of the proposed program. Yes, for a proposed program we need to have national health policy. We need to identify what are the national health problems and work for that problems, prioritize the problems and prioritize the solution. Then you come to the action. Then we need to accomplish the purpose of proposed programs. National Development Planning definition. National Development Planning has been defined as continuous, systematic, coordinated planning for the investment of the resource of a country in program. According to that plan only we can invest our resource. Financial resource we need to invest according to the plan only. So we need to have a proper planning for any action. In health also we need to have a proper planning. Okay. We already discussed about the policy of National Health Policy 1983, 2002 and 2017. We already discussed in the last class. No, so I am not coming to that area policy. Now I come to the concept of, already I completed the concept of health planning, and now I am coming to the planning cycle. What do you mean by planning cycle? For a planning plan also, you should have some cyclical method. Come to that. First one, surveying the environment. In the sometimes the planning cycle and the planning process have some similarity in the points, but the planning cycle we have the cyclical action. Start from a point to come to that same. We come to the starting point at the end of the process. In the planning cycle, we are discussing first one, surveying the environment. Before health planning, we should have to do some survey. As we all know, there are many surveying methods. In research also, health research and social work research also, there are many surveying methods. We can use any method to survey. What do you do? Why do you do the survey? We need to realize the real problem of the health problem, and how much affect the health problem in the common people. All the things we need to get from the survey. Next one, setting direction. After survey, we can identify the real problem and real what solution we need to apply, and what solution we need to execute in that problem. Then we are setting some. We will set some direction to do that, to do the work. After that, problem and challenges. Problem and challenges, difference between what and what ought to be. Problem and challenges means what are the problems and how much the problem affected the common people, common public people. And challenges, what are the challenges made from the problems. That all we need to discuss in the planning cycle. The third step, problem and challenges. And next, the fourth step, in cyclic method, the fourth step is range of solution. Way to get from what is to ought to be, range of solution. After analyzing the problem, we will find out many solutions for eradicate that problems. Then we need to calculate the range of solution. Which solution is apt for the particular problem and which solution is apt for the next problem. So these things we need to discuss and we need to attend. And after range of solution, after that step, we need to select the best solution. We will have many solutions for this single problem. Then in the fifth step, we need to select a best solution for that particular problem. Then after that, what is after best solution? You selected a best solution. After that, what? Yes, implementation. Implementation is the implementation process is to be done. After getting a solution, after reach a best solution, then we need to implement that solution into the work. After that, after implementation, what is the process? What is cyclical process? Next step is seventh step, evaluation. Yes, after implementation of a solution, sometimes a awareness class, sometimes a medication. All the implementation process we need to execute in the public, and after execution we need to evaluate if it is a success or not. Our solution is not success or not. We need to evaluate. Then we need to take another problem and take survey, and these steps we continue. The cyclical process, planning cycle. In this planning cycle, we have 7 steps: surveying the environment, setting directions, problem and challenges, range of the solution, then best solution, and the implementation process, and evaluation, and the next problem and next area. These are the planning cycle. In unit 12, we have concept of health planning. Yeah, we have already seen that. After that, we just saw the planning cycle. Now I am going to the health planning in India. In India, we discuss the health planning related to the 5-year plan. Still now we had 5-year plan, but now we are in Niti Aayog process and Niti Aayog programs. But we need to study about the planning commission and when it is started. Health planning also in India we discussed with this planning commission. Yes, we all know planning commission consists of 7 members: chairman, deputy chairman, and members. Planning commission, when planning commission was there, these are the situation. But now in the Niti Aayog situation, we are and another CEO also and other members of the in Niti Aayog also. Now we are discussing health planning in Niti Aayog process, but I just go through the planning commission process. Planning division, program advisory, general secretariat, technical divisions. And in India, we have parliament. In parliament, we discuss the health planning, and in front of the parliament, in front of the Lok Sabha and Raj Sabha, we will put forward the bill, health planning bill or health planning process and policies. We will put in the parliament by the members of the parliament, and they will implement. The executive officers will implement the process. These are the situation we are doing in India. In India, we have Parliament, Union Cabinet Committee, Central Health Ministry, Planning Commission or Niti Aayog, State, then DGHS, Directorate General of Health Service, Family and Welfare Department, Ayush and Planning Department, Program Offices, and state registration planning board planning department. This was the situation in the past situation. Now it is in the Niti Aayog. We realized the situation of Niti Aayog, and realized you need to study about the Niti Aayog. These things I told about the planning commission and planning commission process also. Okay, in India, government put forward some planning, and the office executives will execute the programs into the action. For implement this action, we need to do some national health programs, and that all things I have already told in the last class. In planning commission, when we discussed about the planning commission, we had many committees in government of India. We had many committees related to health planning. Just go through the committee. 4 committee, chairman Sir Joseph Ford appointed in 1946. In that, in 1946, recommendations were integration and preventive and curative service at all administrative level, development of primary health center in 2 stages, short-term measures. PHC should cater the population 40,000 with a secondary health and referral solution for each PHC, 2 medical officer and 4 PHN. The staff nurse. These things put forward by the 4th committee in 1946. We had many committees from 1946 onwards. We had many committees. These committees recommendations, there would have some recommendations for the health planning. We discussed that also. 4th committee, long-term program, 75 bedded hospital for each 10 to 20,000 population, and 650 bedded hospitals at a regional level, and district hospital with 2,500 beds recommended. This recommendation came from 4th committee, that also implemented in 1946. After that, we came to 1956 to 1961, or 5-year plan. In our 5-year plan, the first 5-year plan. Sorry. In the first 5-year plan in 1951 to 56, but there was no particular committee for health planning also. But the second 5-year plan, 1956 to 1961, the Modalia committee came, and in Modalia committee there was some planning for and some recommendations for the health planning. Just go through that. Consideration of the first 2 5-year plan. 5-year plan started from the 1951 to 1955, but in the first 5-year plan there was no recommendations for any recommendations for health planning. But the second 5-year plan there was recommendations. There were recommendations for health planning. That is Modalia committee. Sir Modalia appointed in 1956 to 1961 recommendations. consideration of first two 5-year plan, strengthening of the district hospitals with the specialties services to serve as central base of regional service, regional organization in such a state between the headquarters organization and the district change of regional deputy and assistant directors, each to supervise 2 to 3 district medical and health officers. In Module Committee, each primary health center is not to serve more than 40,000 population to improve quality of primary health center, PHC, integration of medical and health services, constitution of an all India health services on the pattern of the Indian administrative service. These recommendations came in the Module Committee. After that, 1961, we had another committee, Chadha Committee. M.S. Chadha appointed in 1963. Then there were also some recommendations. Just go through that. In vigilance operations through the PHC at the block level, ex-national malaria eradication program, monthly home visit, 10,000 population to each one basic health worker allocated, and to look after additional duties of collection of vital statistics, family planning given. Family planning health assistance was to supervise 3 to 4 MBHWs at a district level. Then we come to the Mukherjee Committee. 1965 we had a Mukherjee Committee. Chairman Sri Mukherjee appointed in 1965. Some recommendations were there. Separate staff for planning, family planning program recommended. Now in that time the family planning was very popular in 1965. Then Mukherjee Committee put forward some recommendations in that area, family planning. The family planning assistants were specified their duties only in family planning, also recommended the link the malaria activities and other activities from family planning. In that time there were many communicable diseases and non-communicable diseases like malaria and all. In Mukherjee Committee, these committees put forward some recommendations according to that time and time-based problems. Then in that committee, just go through that committee. You should have some idea about the 5-year plan. What were the committees and what were the recommendations in the health planning? Because these all things came under the health planning of our India, our nations. Okay. Jangwala Committee 1967. Some recommendations from Jangwala Committee. Dr. N. Jangalwala appointed in 1967. Integration and organization of personnel, unified cadre, common seniority captain, recognition and extra qualification, equal pay for equal work, special pay for specialized work, no private practice and good service condition should be given. After that, Qatar Committee 1973 recommendations. ANM designed as female health worker, all basic health workers and surveillance workers, vaccinations, health education assistant, family planning health assistants replaced by the male health worker. MBHW introduced the malaria maintenance phase area in the smallpox controlled area. PHC population coverage increase up to PHC population also increased that area. Qatar Committee PHC divided into 16 sub-centers. Sub-centers have given the 3,000 to 3,500 populations. In Qatar Committee, the sub-center idea came. The PHC divided into some sub-centers. In our village also, we can see sub-centers related to PHC. A small center included one JPHN or JHI, two health personnel will be there in sub-center. The Qatar Committee came put forward by the recommendation related to the PHC divided to 16 sub-centers. Sub-centers given 3,000 to 3,500 population that time. Now it is 5,000 population for normal and 3,000 for hill area. A sub-center will be allocated for 5,000 population. Okay. Each subcenters have provided one male and one female health worker. Then there should be each male health and female health supervisors and supervise the work of 3 to 4 male and female health worker. Lady health visitor designed as female health supervisor. Medical officer and PHC has overall the charge of all supervisors and health workers except Kartar Singh Committee recommendations by Government of India. Yes, next to Srivastava Committee 1975, there were many recommendations in the Srivastava Committee. The devise a suitable curriculum for training and care of health assistants so that they can serve as a link between the qualified medical officer and medical public health workers. Suggested step to improve the medical education process emphasis given on the problem relevant to the national requirement, suggested to realize the above objectives and matters. And in the Srivastava Committee put forward by the recommendations of the medical education, and we have many medical colleges in our state and in our country. Nowadays the government is giving many medical colleges in our each district have medical colleges. In 1975, the Srivastava Committee put forward by the medical education area. The Srivastava Committee also gave some recommendations also, creations of bank, para-professionals and semi-professional health workers, and formed within the community itself ex-school teacher, postmaster, gamma cell to provide the simple promotive and preventive curative health service needed by the community. Establishment of 2 cadres health workers, namely MBHW and health assistant between the community level workers and doctors at the PHC. And rural health schemes 1997. Under this scheme, after the committee-based recommendations, we will have some schemes. The Government of India will put forward some schemes for development of health development for health care services. This also come under the planning of the Government of India for our health care providing. Okay. Under this scheme, the Srivastava Committee provided the health care through the trained workers in the community health centers was initiated during 1977 to 1978. Steps were also initiated for involvement of the medical colleges in the total health care for selected PHCs, which the objectives of the reorienting medical education to the need of the rural people. Rural health scheme, reorientation training MPW in control of various communicable disease program into unipurpose workers accepted by the Central Council of Health and the Central Family Planning Council in 1976. Health for All by 2000 AD reported by the working group 1983. We have already seen in last class 1983 onwards we have some health policy. In all the health policies and programs we should put forward some basic principles, that is health for all. We have some motto, health for all. Health for all means the equitable distribution of the healthcare services for rural and vulnerable group. Everybody should get some health care. That's our motto. By 2000 we should have to achieve. We plan to have that achievement in 2000 health for all, but still now we are going through that purpose, health for all. These 5-year plans come under the Government of India planning. 5-year plan, we just go through the 5-year plan. 1956 to 61 Modhlia Committee, 1961 to 66 Chadha Committee, 4th 5-year plan Qatar Committee, 1969 to 75. In 6th 5-year plan 1980 to 85 National Health Policy came. Then no committee would not be there. The National Health Policy came in the 1983. Then after that we planned the health care and the health planning according to that policy. But in 8th 5-year plan there were another committee, Bajaj Committee came. 1992 to 1997 we had Bajaj Committee. After that, 9th 5-year plan 1997 to 2002, there is no committee, but we had a policy in 2002. Now after that, 2017, we have another policy. We are going through that policy. We plan to work according to that policy. After Corona and COVID situation, we will rearrange our planning, and we will put forward new plan method and process and policy and programs will implement after this Corona period. We can expect a proper plan. Now I am going to the next unit, healthcare planning process. Firstly, I described about the health planning cycle. Cycle is one start from the one beginning point, and come to after that we'll come to that beginning point. But the process is a step-by-step process. For a planning, for implementation of the planning, we should have some process. Now we shall discuss about that planning process. Yes, first information gathering. For information gathering means we need to gather the information about the health problem and the health situation. For that we use some surveys and all. In health planning cycle also came the survey method. For information gathering we can work with any strategy. We can collect the information. For collecting information, we can do many strategies, but we need information about the health. What is the health situation of the common people, and what are the threats, what are the opportunities, and what are the strength of the common people. What are the programs we need to plan? These things, if we need to put forward these things, we need to collect some information properly. That information should be correct and it should be viable. Okay. Then after information gathering, we should analyze the health situation. After collect information, when we need to analyze with that information. For analyzing, we need to go. We want to go through some steps. The population, its age and sex structure, statistics of morbidity and mortality, the epidemiology and geographical distribution of the different disease, medical care facilities such as hospitals, hospital centers, and other health agencies, both public and private, the technical manpower of various categories, training facilities available, attitude of beliefs of the population towards disease, its cure and prevention. These steps are analyzing the situation. Now the Corona situation, if we analyze the health situation, what are the population and sex structure, statistics, and medical care. Attitude of, last step we just see attitude and belief of the population towards disease. When the Corona and COVID-19 came firstly, then what were the attitude of the common people towards that disease? Now what is the situation? Situation is changing, but there will be some attitude of the common people towards the disease. That also we need to analyze what are the situation. So if we need to do some analysis, then we need to collect some information. The first step, information gathering and analyze the situation. Then establishment of goal. After situation, analyzing situation, we need to establish some goal and objectives. According to that objectives, we need to work plan. Then, next one, assessment of resource. After establishment of goals, we need to assess resource. We need to collect resource and use the resource in a proper way. We need to seek some resource. We need to search some resource for doing health planning and health programs. Then we just came to the fixing priority. After assess the resource, fixing priority to that selected resource, and then write up a formatted plan. For a planning, health planning, we need to write a plan. We should have some paper works, and we should have some table to complete some task in a timeline. Then we need to plan for each work. Some work will complete in some times. We should have some timeline. According to the timeline, we need to fulfill that goal. After that, program and implementation. After I formulate a plan, we need to program and implementation. After implementation of program, we need to monitor the program if it is going in the right way or not. Then after that, we need to evaluate our health planning process. These are the planning process, step-by-step process of doing a thing, doing work or any action plan. In a planning process of health, in health planning also we need to do the same process, planning process. First, once again we shall go through the planning process. First one, information gathering. Second one is analyzing the health situation and the establishment of goals, assessment of results, fixing priority, write a formative plan, programming and implementation, monitoring and evaluation. These are the planning process. Now we completed the unit 14. Now I have unit 15 also. Rest of the unit is unit 15. We are going to discuss the management techniques and methods. As we all know, in business administration and hospital administrations, and also there are many management techniques they use. The businessman use many management techniques. Like that, the health care and the health planning also some management techniques and methods. Let's go through that method. Before that, we need to realize what is management techniques. Management techniques are many. They are based on the principles of behavioral science as well as the quantitative method. These techniques have been developed by experts by management science to help the managers of any organization to achieve the stated goal more efficiently. Efforts are being made by the WHO for making these techniques more popular for application in the health field. WHO states that the management techniques of behavioral science management techniques and the quantitative method, we can use this management technique in the health field also. WHO already making these techniques in the health field also. Now just to go through the management techniques of according to the behavioral science management techniques. Methods on behavioral science is organization design an organization, a common group of people for an organization design also. Method of behavioral science in the management techniques. Method on behavioral science in management techniques. Management techniques according to the behavioral science study, organization design is the first step, and the personal management, communication, information system, management by objectives. Organization design there will be an organization. We need to design that organization top level to bottom level. In management techniques of the health worker or social worker need to study the management techniques. We all draw some organogram in field work also. We need to create that organogram. Organization means top level to bottom level, some organization settings that we need to create. We need to design that organization design. Okay. Then personal management. Personal management is another area. We all know about personal management. Consider the person to person management techniques. Then communication. Proper communication should be there. Information system. We all have some information system in software. We have many software for information, and we collect the information and proper information sharing. All things in the behavioral science based management techniques. Management by objectives. Management objectives also in the behavioral science based management techniques. After that, quantitative method of the management techniques is quantitative methods of the management techniques are cost benefit analysis. You all know cost benefit analysis. When we when we spend some money, then we need to benefit for that cost. Cost to benefit analysis. Then you should have some analysis in the cost to benefit. After second one, cost effective. What the effective of the when we spend money, then what effect we attained. Cost to benefit analysis, cost effective analysis, then cost accounting, and input output analysis. When we give input, then output should be there. Input output analysis. Model. There will be some. There would have some good model for the management techniques, management managerial action. System analysis, network analysis, planning, programming, budgeting system. PBBS in planning, programming, budgeting system. There should be there will be a planning, programming, budgeting system in the management techniques. Work sampling, decision making. These things are quantitative method of management techniques, and behavioral science techniques where we already discussed the organization design, personal management, communication, information system, management by objectives, the quantitative method, cost benefit analysis, cost effective analysis, cost accounting, input output analysis, models, system analysis, network analysis, planning, programming, budgeting system, work sampling, decision makings. These all things under the management techniques and methods. Now we come to the conclusion. Today we discussed about the health management, health planning and management. In health planning, we discussed about what do you mean by the health planning. We discussed about the health planning. After that, we discussed about the health planning cycle. Cycle means cyclical process. And start from the point and come to that point. Cyclical process. In cyclical process, we discussed about 7 steps in cyclical process. Surveying the environment, setting the directions, problem and challenges, ranges of solution, best solution, implementation and evaluation. These are the health planning cycle. After that, we discussed about the health planning process. In health planning process, we discussed information gathering, analysis of health situation, establishment of objectives and goals, assessment of results, fixing priority, write-up, formulated plan, programming and implementation, monitoring and evaluation. These are the process, planning process. Process is the step-by-step process, starting from beginning to the end. We will we will reach an aim. We will attain our goal after process. If we do an action, when needed to planning in that planning process from begin to end, then after end we will we will attain our goal. Okay. After that, we discussed about management techniques all based on the behavioral science and behavioral science and the quantitative methods. These all things under the management techniques we discussed. Okay, so if you do any action related to health or any where we need to plan properly. After if you do plan properly, then we can attain our goal easily. Through this step-by-step process, we can attain that goal easily. Okay, so I am concluding this topic, module 4. These are the main points. Unit 12 to 15 is under the module 4, health planning and management for MSW syllabus. Mahatma Gandhi University Kottayam is under discussed about the community health for development practice and healthcare administration and community health. Okay, you all, I expect you all understood about this topic. Best of luck for your future study and in future. You need to take some challenges to research in this area. Health planning, we need to challenges for research. You do some research about, if you have any question in your mind, then you take that question for research. For research, you take that question. You ask your questions to yourself, and you just find out the answer. You can find out the answer, but again ask the question to you. Then you can find out that the basic of research. Okay. Then now I am going to stop. Wish you all the best for the MSW students and those who watching this video fully, and best of luck for your future. Thank you.